In the grand saga of modern medicine, every hero has to face their trial. And for a lot of people, that trial is the surgeon's blade. A totally necessary ordeal on the path to getting better, but who stands guard when the hero has to sleep, making sure they get through it all unharmed? Well, today, we're going to meet the Guardians of Slumber.
Yeah, it's a really critical question, right? Surgery is, let's be honest, a perilous journey for the body. It's a planned, controlled trauma that's designed to fix what's broken. But to get through that journey, you need to be protected. Not just from pain, but from the massive physiological stress of the procedure itself. You need a guardian. And that guardian's power? Well, it's called anesthesiology. You can think of it as this super specialized form of magic, a whole branch of medicine dedicated to the total care of the patient throughout their entire surgical quest. The anesthesiologists, they're basically the mages of the operating room, and they wield some pretty potent spells to shield the patient from harm.
Now, a wise guardian doesn't just use the same big enchantment for every single quest. No way. Their spellbook is full of enchantments with different power levels, each one tailored to the specific challenge they're facing. So let's dive into the 4 main levels of anesthetic enchantment.
Okay, so first up, you've got the most focused spell of all, local anesthesia. This is for the minor quests, like getting a few stitches. A very specific, small part of the body gets completely numbed. You're totally awake, you know what's going on, but that one spot is just completely shielded from any pain.
So what happens when the challenge gets a little bigger? Well, that's when the Guardian uses regional anesthesia. This enchantment is cast over a whole region of the body, like an entire arm or maybe the whole lower half of your body. And again, you can stay conscious, but a much bigger area is completely blocked from feeling anything, which allows for some much more serious procedures.
All right, next we get into something really interesting, a state of twilight sleep with monitored anesthesia or sedation. Here, the patient is put into this state of super deep relaxation. Technically, they're still conscious, but they're so calm that they just kind of drift in and out of sleep, and often they don't even remember the procedure afterward. It's really a spell of peaceful oblivion.
And then there's the big one, the most powerful enchantment in the whole spellbook, general anesthesia. This spell is saved for the longest, most difficult quests. With this, the patient is guided into a deep but totally reversible state of unconsciousness. Their body is still, their mind is somewhere else entirely, and they're completely unaware of the surgery, totally protected in this profound slumber.
But just inducing these states, that's really only half the battle. Because when a patient is under a deep enchantment, the guardian has to take control of their most vital function, their breathing. And to do that, they rely on a powerful collection of artifacts known as the airway arsenal.
The first artifact we're going to look at is the laryngoscope. This is a special scope, usually with a light on the end, that lets the guardian look right into the throat and get a clear, direct view of the glottis. That's the vocal cords that act as the gateway to the windpipe. It basically lights up the path. And once that path is clear, the guardian places the endotracheal tube. This flexible tube is carefully guided down into the windpipe, and it becomes a direct line to the lungs. From there, it gets connected to a ventilator, which lets a machine do the breathing, making sure the body stays perfectly oxygenated the entire time. Okay, this next one might look simple, but it's absolutely vital. It's the Goodell airway. It's this curved, rigid plastic thing that just sits in the mouth. Its job is super important. It keeps the tongue from falling back and blocking the airway when a patient is relaxed or unconscious. It's a simple design for sure, but an absolute lifesaver.
Now, there's another way to do this too. It's called the laryngeal mask airway, or LMA for short. This artifact is a tube with this sort of elliptical mask on the end, and instead of going into the windpipe, it just sits right on top of it, creating an airtight seal. This lets the guardian channel all those gases directly to the lungs without having to do a full intubation.
Okay, so we've got the spells, we've got the airway artifacts, but what actually powers all this magic? Let's turn to the seriously complex machinery that lets the guardian control this deep slumber with such precision.
At the heart of the whole operation is the anesthetic machine, and this thing is incredible. It basically has 4 superpowers. It gives a steady, controlled flow of oxygen, it mixes those potent anesthetic gases with pinpoint accuracy, it lets the ventilator breathe for the patient, and it's loaded with safety features to minimize risk. A really key part of that machine is the anesthetic vaporizer. Seriously, this thing is like the alchemical heart of the whole setup. This modern marvel takes a potent liquid anesthetic and, with unbelievable precision, turns it into a vapor. This makes sure the slumber is exactly as deep as it needs to be.
no more and no less.
What's really cool is that even within one type of spell, there can be different ways to cast it. Let's take regional anesthesia, for example. You have two main paths. With spinal anesthesia, the medicine is injected in a single shot directly into the fluid around the spinal cord, and it works almost immediately. But with an epidural, the medicine goes into the space just outside that fluid sac, and a tiny little catheter can be left in place to provide continuous pain relief.
So, the spell is cast, the slumber is deep, but is the Guardian's work done? No way. In fact, maybe the most critical phase is just beginning. The unsleeping vigil. Throughout the entire procedure, they have to watch over the patient, monitoring every single vital sign.
And one of the most important tools for this vigil is the pulse oximeter. I mean, it looks like just a little clip for your finger, right? But this simple-looking charm, which only really became common in the 1980s, literally revolutionized safety by constantly measuring the body's most vital essence, the oxygen level in the blood. So all that data from the pulse oximeter, and a whole lot more, it all gets fed into this, the anesthesia monitoring device. Think of this as the Guardian's all-seeing orb. On one screen, they can see the patient's heart activity, their blood pressure, their temperature, their breathing patterns. It's a constant, complete picture of the patient's state of being. But here's the thing. The vigil isn't just visual. As this quote points out, these monitors are all about multi-sensory awareness. That pulse oximeter, for instance, it lets out an audible beep, and the pitch of that beep actually changes with the oxygen level. So if the level starts to drop, the pitch drops, and the Guardian knows instantly, without even having to look. It is a state of constant, vigilant awareness. So, there you have it. The Guardian of Slumber uses these incredible spells and artifacts to protect the body, guiding it safely through the perilous journey of surgery and all the way back to the waking world. But that leaves us with one final, kind of profound question, doesn't it? While the body is being mended, where does the mind go? Well, that's a mystery for another explainer. Thanks for joining us.